All right. So in our last video, we talked a little about some recent experience I've had talking to patients both in person and through our virtual consultations who have said they were dealing with excruciating back pain. Now, once again, this is not to illegitimize like their pain. I'm sure they're in a lot of pain. We want those people to recover as quickly as possible. But generally speaking, it's not a medical emergency. As always, if you do believe this is a medical emergency, please call 911, go to emergency room. However, in absence of red flags, generally low back pain, even though severe, isn't something that needs a visit to the emergency room. So the first thing that I would probably do is reach out to, obviously, someone like myself, either in person or virtually. You could see a chiropractor. If you're looking for recommendations for a good one, reach out to our office. We can always help you virtually also. I keep telling people, whether it's you or a friend or family, if someone is in pain, oftentimes I can have a conversation with them and try to help point them in the right direction, whether it's to myself, another chiro, their primary care doctor, or the ER, no matter what it is. But what I would recommend right away is trying to find, okay, what makes your pain a little bit better? Is it lying on your side? Is it lying on your back with your feet up? Is it bending forward a little bit? Is it bending backwards a little bit? So move around a little bit, even though that might be very painful and uncomfortable. Typically, we can find a position that's gonna help centralize our pain. Okay, the pain's a little bit less. I can breathe, I can think straight now. And then also on the flip side of that, try to think, okay, this pain came on, it kind of came on out of nowhere. I've never had back pain like this. What have I been doing in the past 24 to 48 hours that may have made this worse? What flared this up, right? Did I go on a long car ride? Was I picking something up off the floor? Was I picking up a shower off the floor? Did I pull my laundry out of the dryer? All of these things could be aggravating factors, and they're gonna be things that we wanna make mental note of, that we wanna try to avoid doing in the near future. And again, those positions that feel better, we wanna make sure we're doing more of those. Once again, please reach out to advice of some healthcare providers, but generally speaking, in most cases, this is not something that is an emergency that needs to go to the ER with. Thank you.